Even though prostate cancer is very common and the second most common cancer death among American men, most people who are diagnosed with it don't die from it. Because this cancer needs testosterone to grow, medicines often try to lower testosterone levels. Testosterone is mostly made in the testicles. This method, called androgen deprivation therapy, ADT, effectively lowers male sex hormones. It is also sometimes called chemical or surgical castration. Surgical removal of the testicles, also known as surgical castration, is a less frequent method. In a recent study of nearly 25,000 men, only about 5% chose this option. Castration by chemical or surgical means has been shown to have equal survival rates, usually around 2 to 2.5 years. But things get tough when prostate cancer gets worse, even though testosterone levels are low. This is called castration-resistant prostate cancer, CRPC. In this video, we'll talk about CRPC in more depth and look at its stages to help you understand your treatment choices and outlook. Types of CRPC. Number 2, metastatic castration-resistant prostate cancer, CRPC. This type of cancer arises when the prostate has migrated or metastasized to other body regions like lymph nodes and bones. At this point, the malignancy has developed a resistance to testosterone stimulation, making typical hormone therapy useless. Regretfully, men whose prostate cancer has progressed and shown resistance to castration die from it most often. Number 1, non-metastatic CRPC. In this kind, the cancer has not moved to other parts of your body and is still contained within the prostate. But hormone medications no longer work on the malignant cells, which presents serious therapy issues. Symptoms of CRPC. Depending on whether the cancer has spread, symptoms of castration-resistant prostate cancer, CRPC, can change. There may be no symptoms at all if your CRPC is non-metastatic. However, depending on the size of the tumor and the affected locations, the symptoms worsen if the cancer has spread. If the cancer has gone to your bones, you may have discomfort or difficulty urinating, blood in your urine, involuntary weight loss, general weakness or exhaustion, and bone aches. If it gets to the lungs, shortness of breath could also happen. It's essential to comprehend these signs in order to keep an eye on your health and seek prompt medical attention. We will go into great detail about the symptoms of CRPC in this video, giving you the knowledge you need to properly manage your illness. What leads to castration-resistant prostate cancer? When prostate cancer is resistant to hormonal therapy, particularly androgen deprivation therapy, ADT, which lowers testosterone levels to stop the growth of the cancer, it becomes castration-resistant prostate cancer, CRPC. Prostate cancer cells initially depend mostly on testosterone for growth, but they are able to adapt and develop defense mechanisms that allow them to live in low testosterone conditions. The cancer cells may produce their own androgens, become more sensitive to remaining testosterone, or experience genetic alterations that enable them to use other growth pathways as a means of adaptability. As a result, these cancer cells continue to spread and thrive in spite of ongoing therapy targeted at reducing hormone levels, indicating the shift to castration-resistant state. Comprehending this shift is essential to formulating fresh approaches for efficiently treating or handling CRPC. If you want to know what the prostate is and its various stages, click on the link in the description below and watch the complete video. Treatment options for CRPC. Number 4, second-line hormonal therapies. Enzalutamide and abiraterone are examples of second-line hormonal treatments that provide novel therapy options for individuals with castration-resistant prostate cancer, CRPC. These drugs function by further inhibiting androgen utilization by cancer cells, which can continue to fuel the growth of cancer even after the first hormone therapy. When conventional hormone therapies are no longer able to successfully control the cancer, they are usually employed. Number 3, chemotherapy. For the treatment of CRPC, chemotherapy is still an essential choice, particularly if the cancer has progressed outside the prostate. Drugs such as docetaxel are used to treat cancer cells because they frequently divide quickly. In the more advanced stages of the disease, chemotherapy may be useful in prolonging lives and reducing symptoms. Number 2, novel agents and targeted therapies. Scientists are continuously creating new drugs that specifically target pathways involved in the evolution of prostate cancer. For instance, PARP inhibitors have demonstrated promise in the treatment of CRPC, especially in individuals who have certain genetic abnormalities. Another field undergoing a lot of research and seeing increasing application is immunotherapy, which fights cancer by utilizing the body's immune system. Number 1, ongoing research and emerging treatments. The main goals of current research are to find biomarkers that indicate a patient's propensity to respond to therapy and to produce drugs that interfere with the metabolism of cancer cells or target the tumor environment. Clinical trials are essential for evaluating the safety and effectiveness of new medicines, providing patients with CRPC with hope for future, more individualized and efficient solutions. How to manage advanced CRPC. Because advanced castration-resistant prostate cancer, CRPC, is resistant to conventional hormonal therapy, treating this illness can be very difficult. Controlling symptoms and preserving quality of life become more important when the cancer gets worse. In order to properly manage pain and other symptoms, patients and caregivers are encouraged to concentrate on palliative care choices. As the disease progresses, regular discussions with medical professionals are essential for modifying treatment regimens. Techniques could include taking drugs to lessen pain, using bone-targeted therapy to avoid fractures, and even enrolling in clinical trials to gain access to innovative remedies. Keeping up with the most recent findings and therapeutic options is crucial for patients with advanced colorectal cancer. A difficult stage of prostate cancer known as castration-resistant prostate cancer, CRPC, endures even after androgen deprivation therapy, ADT, lowers testosterone levels. Men are more likely to get prostate cancer as they age. Thus, it is essential to comprehend CRPC in order to effectively manage and treat the disease. There are two forms of CRPC, metastatic and non-metastatic, and each poses different therapy challenges. Beyond the prostate, frequently to the bones and lymph nodes, metastatic CRPC is resistant to traditional hormone therapy, which usually results in more dire consequences. Therapy options are complicated by non-metastatic CRPC, which has not spread but nevertheless rejects hormone therapies. This movie explores prostate cancer's later phases, including how it progresses to castration-resistant prostate cancer, CRPC, how treatment approaches are affected by this resistance, and the most recent developments in controlling this aggressive stage of the disease. As we work through these challenges, continue to follow and remember to join the conversation and keep informed by subscribing, sharing, and commenting.